Please welcome CareZooming. You want to use this or just that for now?
So hello, everyone. Thank you so much for coming here tonight. My name is Ashley Shaw. I am a co-founder of CareZooming. And I'll start with a story as well. So 6 or 7 years ago, I was a junior healthcare administrator in a low resource healthcare setting, a skilled nursing facility in Spanish Harlem in New York City. And I was given the task by the medical director to find ways to improve the integration, bringing chaplains into the end-of-life care planning process for our patients. And so this is something that I didn't have any expertise in, as having just graduated from college. I was given this task, so what did I do? I Googled it. And what did I find? 1 million articles, a lot of accounts, some research articles, some proprietary information. Didn't know where to start, didn't know how to interpret the data, and essentially took us probably 3 months to even find a warm lead who would tell us how to do that. So fast forward to now, I'm a medical student. I actually just applied to residency. I'm going to be a primary care doctor. I met my friend Lisa Rodenstein, who's a doctor, a primary care doctor at the Brigham and Women's Hospital. We find that our peers and colleagues are doing the exact same thing, and this is draining clinicians of a lot of energy that they need for patient care. It's also costing their clinics hundreds of wasted dollars and hundreds of hours as well. So we came up with a solution to hopefully be the WikiHow or the Wikipedia of healthcare delivery, and that's CareZooming, which is a platform that connects frontline clinicians to one another for technical expertise on their next healthcare delivery project, and we really hope to help them deliver better healthcare faster. So the problem, like I talked about, is this frustration that's even in this first step of making change, finding the information you need. $320 billion are wasted each year in U.S. on healthcare inefficiencies, and that's administrative and operational inefficiencies. So we want to help tackle that problem. Now, process improvement, measuring results often uncompensate the last to do for these frontline clinicians who really bear the brunt of implementing the solutions that everyone here is coming up with, and they're really inspiring solutions. Healthcare providers find themselves reinventing the wheel when implementing new projects. The information is dispersed, delayed, academic, and quite expensive. So our solution is really for frontline clinicians, medical directors, nursing directors, population health managers, strategy and innovation people looking to improve healthcare. Our platform identifies innovation bright spots from around the country and empowers clinicians with the information they need to implement that change tomorrow instead of weeks to months to years from now. And so how this works, right now we have been scouting out projects from around the country that have already been implemented in either clinics or hospitals or across healthcare systems. We have a great team of student editors who actually conduct 30-minute interviews. They actually go through the editorial process, they process the information, and they write up a nice recipe that we put on our database. And so what we hope, this is a snapshot of our website right now, but what we hope is this process would become like the retail process of buying a dress on Macy's. Okay, so imagine many of you probably have people in your family who are doctors or nurses. They often have the best ideas for patient care. So they already have an idea of what they want to do. So let's say, let's take Lisa, for example. Lisa's an internal medicine doctor at the Brigham. She wants to do something in diabetes prevention. So she would say, I work in an academic medical center. We already use Epic, and we spent a lot of money implementing that system. We already have MAs, PAs, NPs in our system. I've been given a timeline of 6 months and a $5,000 grant. Show me projects in diabetes prevention from across the country that that have used these inputs and connect me with that person. So that's what we're trying to do. Taking that process from hundreds of hours to just a couple of clicks. So the way we do that is also everyone we collect a project from and we help them co-produce our recipe. We also add them to our Innovator network. So this is a collection of people from around the country who have done this and have past experience with this. And we also do the matching and scheduling to connect people for one-on-one micro-consulting sessions as well. So we also help people with research, and like I said, we connect them. So how we hope to bring this to market, we hope this will become like UpToDate or New England Journal of Medicine, which is a subscription-based platform for individual clinicians and healthcare institutions. We also have found we can help healthcare solutions companies reach new clinical partners by generating these recipes of their implementations so other people across the country can find them as well. So a little bit about Lisa and myself, our advisors, and our supporters. And now time for our demo, which is just our website. Here we go. So this is our home page, but here's what I want to show you. So we are starting in topics in primary care, and you can see we have collections. So we have behavioral health integration, diabetes management, digital health and technology integration, hepatitis C, hypertension, opioid management, and practice management as well. And then the last one is social determinants of health. And if you click into one of these, so let's do this one up here, which is one of my favorite. This team managed to integrate a mental health counseling telemedicine program into to use with their patients in rural Texas. And so if you go here, and every one of our recipes has the same format, you'll see we break it down for someone who would want to replicate this program in their setting. Organizational context, patient population, funding, tech involved. This is where my partners here can help us out. Daily workflow, budget, where we are, outcomes, benefits, challenges, and metrics as well. So we help them interpret how putting this into place in their clinic could help them qualify for different metrics programs as well. Okay, yeah, that's it, actually. So I'll take questions. Yeah. Yes? How you finance? Great question. So right now we have pre-seed, I don't know the actual VC terms, but we have funding from the Brigham Women's Hospital. So that's how we're financed right now. We're also getting some money through Harvard Business School as well. And then what type of funding we're looking for? I would say we're looking for a strategic partner. We're looking for clinical partners who will help us with this. Certainly looking for really all types of funding. The future of the company, as long as this is a problem, we're going to be working on it. Lisa and I plan to be full-time clinicians, but we're looking for co-founders as well. Yeah. Yes?
So I have two questions.
Yeah.
So the first question is around risk management.
Sure.
Like it's sharing information with providers around how to administer therapy.
I would say it's not so much the therapies that they're administering, but how they set up the workflows in their clinic to administer those therapies.
Right, so it's not around care, but
How you deliver care. Yes.
The second question I have is, have a label approach to this, where large provider networks, where they want to control don't want people just coming in, rather just have their own staff being able to collaborate. Have you thought about that?
Yes, we have. We're actually, we have a pilot for an internal innovation database with the Brigham Women's Hospital right now. That's certainly a need of lots of big healthcare systems, yeah, or even hospitals or clinics. Yeah, thanks for your question. Anyone else? All right, so anyone who has any clinicians in their lives, we're trying to make their lives easier, so please tell them about us, and I'll be over there. Love to talk to each of you as well. All right, thanks so much.